Okay. So first thing I want to talk about is the out-of-region transfers we've received, and I'll actually pass it immediately off to Karen Riddell to speak to this slide. We can unmute Karen.
Oh, good. There we go. Thank you. So good evening, everybody. So this slide really summarizes the work that we've done to support our regional partners as well as our other provincial partners. So over the course of the last number of weeks, we've accepted 69 ward or non-critical care transfers from the GTA, so the Greater Toronto Area, and 21 ICU transfers. Most of those have been from London, and most recently we've accepted 3 from Manitoba, from Winnipeg. So that's a total of 90 transfers that we've accepted over the course of that time period. And to date, 83 of those have been discharged back home. We've got 4 of those remaining in the ICU and 3 on the ward. So overall, we were able to increase our capacity to support our partners, and our teams did an amazing job accepting these patients, doing really solid transfers both in as well as back out and home, as well as connecting with the families. As you can imagine, this was very challenging for those families, being so far away from their sick family member. So our teams did a great job in connecting them throughout their stay in the hospital. So we're very proud of the teams, from our leadership team to our frontline staff to our professional staff. They did an amazing job really stepping up and being able to support our partner hospitals within Ontario and now most recently Manitoba. So the teams have done a really good job. We are glad though to see the numbers coming down. Not going to lie, our staff are very tired. It's been a long 16 months and there's been a lot of pressures across multiple areas of the hospital, whether it's in critical care, the emergency department, our PACU, our ORs, our med-surg units, and our allied health staff. So we are looking forward to hopefully the numbers are coming down significantly provincially. And we are hopeful that our staff are going to get a well-deserved rest. So certainly we're very proud of the work that the team has been doing over the last 16 months, but definitely over the last number of weeks, they've really made us proud.
Thanks, Karen. Yeah, it's been, throughout the whole 16 months to get to this point. But definitely to be in a position to be able to help out the rest of the province and technically Manitoba as well, or just over the last 6 weeks. And all of this occurred since April the 1st, so April and May, taking 90 out of region transfers and having 7 still with us. But it's been difficult, clearly, on the patients and on the province and on Manitoba, but also our staff. This has been very difficult for them to do this work, but they've done it exceptionally, and so proud of what they've done. And hopefully we can move forward. And but the other thing we will be seeing is most likely more Manitoba transfers will be coming in to our region over the next couple of days and possibly next into the weeks, as they are not out of the woods yet in Manitoba with respect to needing help and support. So we'll play that out as it unfolds and work with the provincial partners to make that happen. What I wanted to highlight is, okay, now our way forward. Getting through COVID, getting on the other side of COVID, on the other side of the pandemic, what does it look like? What are we looking forward and working towards, and what's the rest of the province? So this is a a slide that's been used across the province to talk about a time period. And I'll focus first on this time period, which is now June to September of 2021, which is called the stabilization or stabilize period of time over the next few months. And stabilize is defined as the health system workforce ensures available capacity to recover from COVID-19, lifting temporary and emergency measures in place, and to manage the urgent capacity needs. So for instance, a couple of weeks ago, we went from doing nothing but urgent or emergent surgeries to then being able to do surgeries that did not require inpatient beds. We started doing that and starting to ramp up. Now we, along with the rest of the province, subject to certain very specific criteria, can start to even expand that and start using inpatient beds and critical care beds, but still being available to answer to the needs of our province, as well as region, as well as country, and the demands that are needed from a critical care capacity as well. So that's going to be the stabilization phase over the next few months to hopefully get to a point of being able to stabilize our operations, get on the other side of the pandemic, and be in a good spot. There's still some issues we'll talk about a little bit later on what could prevent us from doing that. The next phase, the orange part, is the sustaining phase from March 22 onwards, but I'll first talk about this green phase, which starts in October to March 2023, so over 2.5 years. It's the restore. It's how we look at the areas that were adversely affected as a result of the pandemic, while starting to really examine what the pandemic has unveiled, which is pre-existing health inequities, prioritizing certain populations and communities, which were disproportionately impacted by COVID-19. So it's doing this work from October 2021 over the next couple of years in order to restore, in order to not lose sight of what was uncovered during COVID-19, and ensuring that those issues are addressed and are actively addressed, be it in long-term care, be it in acute, be it in subacute, be it in the community, taking a look at those areas and ensuring that we're able to restore them as well as learn from them and make the system stronger. That dovetails nicely into the transformation stage as well, which is to adopt new processes, care pathways, structure, where there's fundamental change required. So one of the issues we talked about in the past, is an issue with respect to the patients that are going to the patients who currently use ICU beds, say post-surgery. Do we need to continue to do that? Can we change that? So a couple ways, of course, to increase critical care ICU capacity is, of course, build more ICU beds. Well, there's a limited physical structure in every single hospital in the province, that there's limited amount of, quote, new ICU beds you can build. And there's not a lot of, quote, new builds coming on over the next 4 years. So as a result, it's looking at how you're doing things now. How can we maximize the 2,300 ICU beds, base ICU beds we have in the province right now, by looking at the patients that are using those ICU beds? And that's something that came up during COVID, especially with respect to getting critical care access maximized, is all hospitals, large or small, examining that. And that's the type of transformation that's going to be taking place, along with multiple other things, but that's just one example. And then the last thing is sustaining things, is positive changes that have been effective. So things that have occurred during COVID that have been very effective with respect to the way the system is run. So one of the things we've clearly identified is a more seamless system. The new Ontario Health West region, which goes as far as Hamilton to Windsor and the Grey Bruce Peninsula, has been very effective in allowing broader communications, not just regionally or sub-regionally, but a larger region, have better communication, better flow of information, uh, quicker adoption or adapting to things that are happening, not only sub-regionally, but regionally. At the same time, they're looking at moving forward with one leader for being responsible for both the West and the Central region. And they're actively now in a recruitment stage to have one individual lead over both regions. That's still going to have 5 regions across the province, but the Central and the West are going to be much closer together. So Central, one of the areas, of course, that includes the Mississauga area all the way up to Muskoka. So that's clearly, as was highlighted during wave 3, is the relationships between the central organizations and the West organizations with respect to patient flow was very positive. So it's a very positive approach. So this is what is being planned for the province moving forward with the 4 different areas: stabilizing, sustaining, transforming, and restoring. And just gives you an idea what's being worked on, not only locally, but provincially on our path forward. Now, what has also happened recently since our last board meeting is they came up with some new names for the variants. Is they didn't want to attribute the variants to the countries in which they seem to have been found in, and actually they identified that even though some of the names, we'd call the Indian variant, you didn't know if it actually started in India. It just was discovered there, but it could have started somewhere else. So they are using Greek names with respect to the variants. And the one we're going to end up focusing on today, which are taking over a lot of the discussion, is the Alpha variant, which is what was formerly known as the United Kingdom variant, and also the Delta variant, which was formerly known as the India variant. Now, this is variants of concern. And then there's also, before they become variants of concern, there's what's called variants of interest. These are ones that have been identified, but not yet concerning, but they're interested in the sense of they're there, but they haven't taken a stronghold yet to cause great community spread and or spread from maybe one country to another country. The one in here that got a lot of reaction is the Kappa, which is the one that seems to be a combination of the Delta and the Alpha. But again, that's very new. But the ones we're really going to focus on are what we need to focus on as a province and as a nation. And internationally, that gets a lot of discussion right now, is the Alpha and the Delta. Then we're going to jump into doses, and we're going to tie all this together shortly. We've had a lot of discussion with respect to first doses, and Canada, when it comes to first doses, has done a pretty good job. 58.3%. We started off slow, but we did pass a lot of countries with respect to first doses. So for instance, even the United States down here, and this is total population, is 50%, just over 50%. This is as of June 1st, 2021. We're just trailing Israel when it comes to first doses. We just passed the United Kingdom, but we're pretty much neck and neck with the UK with respect to first doses. So overall, with respect to first doses, again, we've done pretty good we've done very well as a country when it comes to first doses. Again, looking at comparing ourselves to other jurisdictions, as stated, we're very close to the UK, and we passed the United States when it comes to first doses sometime in the middle of last month, in the middle of May. So overall, another way of looking at it is we've done well at that point. Now, the problem. And I'll hand it over to Dr. Saad very shortly. It's what's the percentage of our population that is got second doses in them? And out of that 58%, only 5.7% of our population has second doses. When you look at United Kingdom, they're at 38%. The United States is 41%. And these are the total population, not just adults. So all these numbers are a little bit understated. If you just look at, say, even 12 and above or 18 and above, depending on who you're listening to. But this is the total population. But Canada's second doses is nowhere near what it is in the United Kingdom and the United States. Oops. This is another way of looking at the chart, and it compares ourselves to many different countries. And the last time I checked, and it still is true, the difference between the first doses and second doses, Canada has the largest gap out of all the countries. Is the disparity between the two is greatest in Canada. One could argue if we had, and not argue, but it's mathematically there, if we were to be giving 41% of our population had received already first and second doses, we barely have enough to hit that, to be able to do that. And we don't, because technically this 53%, if half of it was to go to second doses, then this number would be down to 20, 25% or 30% maybe maximum, if you were to divide the two. So instead of having 60% of our population with one dose and 5% with two doses, so 65%, divide that by two, the best we would get is like 32% would have both first and second doses, the highest. And if we were to announce today that only 32% of our population had both first and second doses, I think we'd have a pretty negative reaction to that as a country. We seem to spend a lot of time focusing on first doses, which is great. And that was the strategy. But time is of the essence right now with respect to getting the second dose numbers up and up quickly. So I'll pass it over to Dr. Saad to talk about the impact of the difference between 1 and 2 doses and the variants of concern I talked about. Dr. Saad, you just gotta unmute him.
Thank you, David. So when it comes to the original virus, what we call the wild type, we know that 2 doses of the mRNA vaccines offers at least 95% protection. 1 dose offers about 80% protection. But all of those numbers really almost go out the window when you're dealing with any type of variant, starting with the Alpha variant and now working our way down to the Delta variant, which is a major concern. We do know from evidence, especially from other parts of the world, that if you have 2 doses of a vaccine, you are much better protected against even the variants than you are with 1 dose. The 1 dose will get you out of the first wave. It got us out of the second wave. It's even helping us get out of the third wave. But as some of these subsequent waves are being driven by variants, 1 dose is certainly not going to be enough to protect us and to keep us from having a 4th wave and future shutdowns. I felt compelled enough about this issue to even write a letter to the Prime Minister myself because, and I know this board is aware of this, because a 1-dose summer and a 2-dose fall leaves a lot of Canadians, millions, vulnerable to a 4th wave driven by variants. Right now, the predominant variant in Ontario is the Alpha variant, but there's a slow increase, and we're worried about the slow increase because we know it could be exponential later, of the Delta variant. And the Delta variant is one that's driving a lot of the wave right now in the UK. We do know that 2 doses will protect you against that. And that's why it's critically important that we get 2 doses as soon as possible. We also know that 2 doses will keep you out of the ICU and keep you out of hospital. And I can tell you from the patients that we've been looking after in our ICU, the patients we've had transferred, as Karen said earlier, from the GTA and even from Manitoba, did not have adequate vaccination. Some only had received 1 dose, and most had received no doses. So the only way we're going to continue to open up the country and the economy and keep things moving along as we have been with the numbers that we're seeing right now is to ensure that we have 2 doses available for everybody as quickly as possible. A 2-dose fall is going to be a disaster, in my opinion, for the summer, because we are not going to be able to continue to open up if that's the case. And I think we're starting to see some of that from the ministry. You're starting to see more and more about what David's putting up right now. Second shots should be offered as soon as possible, which from the National Association, National Advisory Committee on Immunization, NACI. So that's going to be critically important, and hopefully they'll be able to open it up. They're starting with the age groups, but in my opinion, I think we should just open it up to anyone who needs a second dose or is willing to get the second dose. The only problem right now is the limit on the number of vaccines that Canada has. And so again, lots of attempts to try to get more vaccines over from the US or anywhere else we can get our hands on. But it will be critically important to fend off against the 4th wave and subsequent lockdowns over the summer.
Thank you, Dr. Saad. And interesting enough, when Dr. Saad wrote his letter to the Prime Minister, it was before this report came out. I think it was a couple days before. But even without this data, Dr. Saad had identified in that letter this concern, this exact concern, without even having this data, but knowing that the discussion at the time was the lack of efficacy of a 1 dose as to not only the Kent, but also the Indian variant or the Alpha and the Delta variants, and the concern with respect to 1 dose and the efficacy of that, and our push and our continued push to get more vaccines into Canada and or Canadians to the vaccines. Pick one of the lanes and let's take advantage of one of those lanes as best we can. So when it comes to our local statistics and how this plays out, and for those that don't go there, but Friday, WeChew does kind of a weekly they do a weekly wrap up, and they go through all their data and they post on a weekly basis all the data from their epidemiologists post this, and there's some great information there, a lot of great data that has been collected and is up to date. So this is our vaccination status of new cases that identifies how many of our cases currently who have been vaccinated are positive. And you can see going back all the way to December, this number was rather dramatic. It's almost 100%, 96.7% of our cases are unvaccinated individuals. But even as you get to here, by vaccination status is partially protected is still 46% of our cases. Fully protected is a very small amount of our cases. And as Dr. Saad stated, individuals we've seen who are fully protected or even 1 dose and have had 2 weeks post the first dose, we're not seeing, at this point, we're not seeing those patients in the hospital. But unfortunately, with the new variants coming out and the concern with respect to those variants, we got to get those 2 doses in people's arms. So our overall vaccination rate range by age group, it's again, as of March 21st, done pretty good with respect to especially these groups here. The 50 plus have 81% first doses, which is very high. Our overall coverage is again around 54%. and these numbers, as we're getting through those age groups right now with respect to first doses, continue to rise. Clearly, some of the hesitancy will be forming, in these younger groups, and we want to keep pushing those younger groups up. And I'll talk about probably one of the ways that they will start pushing up is with respect to what's going to be happening with, most likely with respect to our border and the fact we live on a border city. Also in this group that is not captured is some of these individuals work in the United States and have received both their doses in the US already. WeChew tried to voluntarily get this information from some people. That's, they tried their best, but that's, I think they topped out around 2,000 people identified voluntarily. We know that number is much larger, and that's going to most likely occur in a good chunk of this age group, who, healthcare workers, let alone all of the truck drivers and essential workers that work in the United States and Detroit area that travel back and forth and have received their 2 doses over there. The system that we have in place, what's called the COVAX system, is supposed to start tracking that. And I know I'll talk about it, the concept of a vaccine passport will result in that starting to be tracked, is no matter where you get your vaccines, it'll be tracked with respect to that information. So we'll have a better picture probably over the next few months with respect to how many Windsor Essex residents are truly vaccinated with first and second doses. So talking about the border and what could possibly be coming up is there's a lot of rumors, a lot of speculation, but the way it stands now is starting June 21st is the mutual agreement between the United States and Canada is up for renewal and or expiry by one or both countries. There is discussion, it's been in the media, that the United States is hinting at the fact that they are not going to be renewing the border closure for people entering the United States as of June 21st, is they're not going to renew it. This does not mean, though, that people who leave Canada, say Windsor Essex, and go to the United States will be free to go to the United States, most likely, but it's going to be their return that they might be met with some issues. So for instance, somebody going to a ball game at Comerica Park, June 8th, they're opening up the ballpark for home fans, full attendance. If you want to go to a game, you might get to the game rather easily, but coming home might be a little more difficult in the sense of coming back to Canada, depending on how many doses you have. So this is taken from the Government of Canada website. They're on May 28th, they released this, and this was released by a committee called the Testing and Screening Advisory Panel that reports to the Minister of Health for the federal government, Minister Hajdu. And they made certain recommendations. Again, these are recommendations. These are not the rules that are in place. They're their recommendations to the Minister of Health, indicating that if the border is open for people to go over the United States, what should be in place upon the return. And if you go to this website at this link, there's a whole report that's produced. And what I've done is I've taken from that report this little diagram, which I think is very helpful. So it breaks people into non-exempt travelers. And those are people who are not exempt travelers, which are essential workers. So right now, the people crossing the border are called exempt travelers and or essential workers. So if we just focus on them, what they're saying is that would continue. Nothing changes as a result of the border rules, except you might want them to agree to voluntary testing. Because of the variants, again, it's voluntary, not mandatory. So if they agree to be tested, they agree. If they don't, they continue on. So that's the recommendation they're making. However, if we focus on the non-exempt travelers, so that's everybody else who hasn't been traveling across the border for the last 14 to 16 months, They break them into non-vaccinated, partially vaccinated, which is 1 dose, or fully vaccinated, which is 2 doses. They recommend for non-vaccinated is not only you need a pre-departure test, meaning you need a test before you even leave the country, but when you come back, you're going to be quarantined, plus have a 7-day test. Quarantine meaning the regular 14-day quarantine when you come back. So that's not vaccinated. That's not getting 1 or 2 doses. So arguably the United States could allow you to go to the United States, go watch that ball game. But when you come back, if you haven't had 1 or 2 doses in your arm, you're going to be quarantined for 14 days. Again, recommendation. Partially vaccinated is you're going to be quarantined as well, even if you have 1 dose. So you're still quarantined, and you're going to have a test on arrival as well when you arrive into the country. So you're going to be stopped and tested immediately. The level of your quarantine might be different depending on the results of that arrival test, but arguably you could still be quarantined for 14 days on the recommendation, even if you got 1 dose. And this is, by the way, 14 days post the dose, meaning you could, if you got 1 dose on June the 3rd and you went to a ball game June the 4th, doesn't count. You need 14 clear days past your vaccination date to even be considered partially vaccinated with 1 dose. Fully vaccinated, which is 2 doses plus 14 days. So you need, again, if you got your 2nd dose on June the 3rd, you went to Detroit June the 4th, tried to come home, you're not considered fully vaccinated because 14 clear days haven't passed. They are recommending you still have an arrival test when you arrive back into Canada. And again, if that's positive when you arrive back into Canada, you could be subject to quarantine, or will be. And if it's negative, you won't be. But it'll be a test that'll happen at the border, even if you're fully vaccinated. But fully vaccinated and a negative test, you have no quarantine. So, I mean, in my opinion, this will drive a lot. If this is what is coming, we have to be ready for this. And be ready for it from a point of view of people wanting to travel to the United States, but not being able to do so because they're possibly partially vaccinated. And if they do, they risk being quarantined for 14 days coming back. But also the need, aside from the clinical issues that Dr. Saad identified with respect to the variants, is our community in Windsor, Essex. That same group, the 20 to 40 to 50-year-olds, even the 80-year-olds, my mom's 82, my brother lives in Dearborn, and she would love nothing better but to go visit him. She's going to have to wait 14 days post her 2nd dose to go visit him. Luckily, she's getting vaccinated with her 2nd dose, so possibly by the time this happens, it'll be cleared. But we can go on and on with those stories with respect to 60-year-olds who have loved ones who live in Detroit or live in Michigan and want to go visit them and haven't seen them for 16 months. Even when this happens, if we don't got 2 doses in their arms, they can go, but they're going to get quarantined for 14 days coming back. So we have to recognize that is the reality. Aside from the clinical reasons why we need 2 doses, there's some practical reasons. Again, these are recommendations, but they're Government of Canada recommendations that have been submitted to the Minister of Health with respect to how Canada should treat Canadians if the border opens as of June 21st or later, how Canadians should be treated. It's all on this website, and I find it interesting. But also it's another reason why, as a border city, we need to really push to get our citizens in Windsor, Essex vaccinated who have these stories, and they're multiple stories with respect to their loved ones. Also, what we're hearing is the G7 summit is coming up. And for those of you who might not remember who the G7 nations are, they're listed here, US all the way to Japan, with respect to the G7. Boris Johnson announced the other day in preparing for the G7 that he wants an agreement at the G7 some sort of agreement with respect to what they call vaccine passports and how they're going to work between these nations, which includes Canada, of course, and the United States. So people traveling between those two countries, how these vaccine passports are going to happen. Justin Trudeau is quoted in this story. He issued a release that says a broad consensus has emerged between the first ministers on efforts to develop proof of vaccine credentials to enable international travel based on sound principles, including respect for provincial, territorial jurisdiction, and privacy of health information. So basically said, it's too early to discuss the reopening of the country to international travel. He did state they are ready to have a discussion with respect to vaccine passports. So that's going to be happening very shortly, the G7 discussion. And that coupled with what I just talked about, the border, it's all lining up with respect to what's going to be happening and impacting us locally. Today's news, which was a good start, is the United States indicated they're going to be donating 25 million vaccines. Some of it has already started to ship, but it'll be in the month of June. 19 of that 25 million is going to be going to COVAX. And for those who might not remember, COVAX is the entity that a bunch of nations created to have vaccines purchased for countries that didn't have the financial means to purchase vaccines on their own. It's like a collaborative, you would call it. So they're going to put 19 million doses into COVAX. And these doses are primarily Pfizer, Moderna, and J&J. AstraZeneca is a separate discussion, not part of this. So these 19 million will be made up of those three components. How it's divided, who knows? But 19 million will go into COVAX. 6 million of that 25 is going to go to what they call regional priorities and partner recipients. And one of those includes Canada. So the 6 million will be divided amongst these partners. So if you count, we got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and United Nations frontline workers. So I'll say 12 entities who will get 6 million vaccines. So assume it's divided up equitably, not based upon population or anything like that. So let's assume Canada gets 500,000 of this, right? Of the 6 million, because there's 12. So we get 500,000 of it. Just so you know, on a given day, Ontario itself vaccinates about 150,000 people, the province of Ontario. So if we get 500,000 as a nation, Ontario usually gets about half of that. So we would get about 250,000 of those doses, which would then be about, what's that? 250, day and a half, day and 3/4. So you can't look a gift horse in the mouth, meaning we're not going to say no. Every dose helps us get closer to what Dr. Saad talked about, but we have to take this into the context of it, is that it gets us a day and a half closer to where we need to be, but it's not the ultimate solution. Hopefully it'll be more as we go along. But again, this concept of getting Canadians to the border to get vaccines is critical and is needed in order to get these second doses into as many arms as possible. So, Mr. Chair, there's a lot there. Hopefully tied all the topics together, but open for questions.
Oh, thanks, David. Questions for David? David, thanks for all your hard work, and to everybody, the staff, appreciate it.